The following segment is sponsored by Sleep Dentistry Defined Implant and Laser Center.
Welcome back to AM Northwest. You know, your teeth could be the cause of health issues throughout your body. Here to share how permanent dental implants could solve that, we welcome back from Sleep Dentistry Defined Implant and Laser Center, Dr. Heath Lampee. Good to see you again.
Thank you, Helen.
All right, let's talk about the fact that you often have patients who come in and they haven't seen a dentist in years.
Sometimes decades.
Yeah.
A lot of my patients haven't been to the dentist in 5, 10, 20 years. And the reason is maybe they had bad childhood experiences. Maybe they're afraid to know what's going on in their mouth. They know something's broken,
Right.
something hurts. And sometimes, you know, maybe they didn't want to, it wasn't in their budget.
Right.
And so when they finally come in after all this time, we get a good look of what's going on in their mouth. And for a lot of these patients, they know that their teeth are broken. Maybe their gums bleed, their gums are inflamed. And they don't realize also why they haven't been feeling well in the rest of their body. And a lot of these patients, sometimes they have 5, 10, 15 infections in their mouth
wow.
that are slowly kind of leaking into the rest of the body.
Right.
It affects the heart, it affects everything else. And so all this bacteria that is in the body is making it so the immune system can't make the rest of us healthy.
Well, and you've talked about what's in our mouth affects, as you said, the rest of our body.
Yes.
We're not feeling good, it affects diabetes, it affects all sorts of things, right?
Diabetes, increased risk of heart attack, increased risk for a lot of things. What it is it's basically chronic inflammation and chronic infection affects the rest of our health, so that the rest of us isn't as healthy, we don't live as long, we don't feel as good, we don't have as much energy.
Right.
And so by actually looking at this and saying, we can take care of this, a lot of times the teeth need to come out. They are that infected.
Right.
And so when we remove all those infections, over the course of the next couple months, the body starts feeling better, the patient starts having more energy, and the immune system can finally chill out and relax because it's not having to constantly fight the infections in the mouth anymore, stuff that the immune system has been fighting for 5 or 10 years.
Explain how the dental implants work.
So in one day, we can actually, with sedation, so a little bit, you know, the sleepy medicine,
Right.
we get all the teeth out. We actually have to do some trimming in there so the new implants will fit. And so we put the implants in that day. And then we also take an impression that day so we can actually screw in permanent teeth in 24 hours.
So you have a patient, Sue,
Yeah.
who you did the dental implants. Tell
Yes,
me
we
her
did.
story, because I think it's an incredible
So,
story.
so Sue came from about 2 hours away. She saw us on television.
Yeah.
And for years, she knew that her teeth were not doing well. And all of a sudden, they started falling out. Energy level was bad. They started moving around, so there was gaps in her smile. She knew she finally needed to do something. So she drove 2 hours to see us. And it was also 4 months away from her daughter's wedding.
Yeah, she wanted to look good. She looked
Yeah.
fantastic.
Yeah. So that is, after 4 months, we did all the surgery in one day, but the final connection for the implants in this case was 4 months later. And that was just a couple weeks before her daughter's wedding.
Wow.
And so
What are the temporaries like?
so the temporaries look just like that,
Okay.
actually. It's just they weren't connected to the implants.
Okay.
And so it took 4 months to finish her case. And like I said, that was right before the wedding, and she looked phenomenal that day. And it was interesting because she had finally had that renewed sense of confidence where she had a friend come over and just say, you're beaming, you're feeling great.
Yeah.
And she finally could smile again.
Yes.
She'd hidden her smile for probably a decade. And all of a sudden, just in the course of a day, we can give that back to her and her health.
Right.
And then get her just ready for that big day with her daughter. And she smiled so well.
So mentally she felt great, and
Oh, gosh, yeah.
physically, what was the improvement? You said she felt better.
She feels better.
Yeah.
Better energy.
Right.
Less risk of infection. Her immune system is better. She's going to live longer and feel better.
Yeah, I just don't. I think it's interesting because nobody gets the connection between what's in our mouth and what's
No.
happening with the rest of us.
They don't talk about it. They don't teach us that in school. And then of all the thousands of hours of education I've been to since I finished school 13 years ago, nobody talks about this. It's something that I've seen day in and day out where I have patients that they come in after 10 years, we take all the infection out, and 4 months later, they are different people.
Right.
And it really bothers me that nobody talks about this.
Yeah.
And so we're finally starting to get more and more studies that show the correlation, and I want to bring that into the light so people understand what's in the mouth affects the rest of us,
Right.
and vice versa.
Yeah, absolutely.
Yeah.
Thank you so
Thank you.
much. If you'd like to find out more about Sleep Dentistry Defined Implant and Laser Center, give them a call, 503-646-2273. We'll put all that information for you on KATU.com. Thanks so much,
Thank you,
Doctor.
Helen.
Appreciate it.
Yeah.
Coming up next on AM Northwest, it might be the most versatile seasoning that you can have in your kitchen. We look at the many flavors of miso. Stay with us.